Well, good morning, everybody, and happy Thanksgiving week to you. I'm Mayor Greg Fisher of Louisville, so thank you for joining us here today. We're a couple of days away from our second Thanksgiving since COVID-19 entered our lives, and while I'm thankful to say the situation is a lot better than it was last year, our entire community still is not where we need it to be for everyone to be safe all the time from the virus. In a little bit, we're going to talk about the precautions that everyone can take to safely enjoy each other's company over this holiday season. And that's going to start with safe and highly effective vaccines that are widely available throughout our community. So let's start by bringing in Dr. Sarah Beth Hartledge. She's our Associate Medical Director for Louisville Metro Public Health and Wellness. And Dr. Hartledge is going to review the latest data with us. Doc, take it away.
Thank you, Mayor. So we're going to take our normal look through the data for COVID-19 in Jefferson County. We are back or remain in the red zone. So our current incidence rate is 26.9 cases per 100,000 population, with 25 cases per 100,000 being the cutoff for the red zone. We have been sort of bouncing right around that line for the last couple of weeks. We had 1,444 new cases last week, and the death count newly reported is 45 new deaths. That represents a significant data reconciliation with the state, and 8 of those deaths are new from November of 2021. The others are from February to September of 2021. As I mentioned, you can see that our case counts are relatively stable, but have hovered in that red zone area. We have not reached the lows again from where we were in the summer in June and July of this year. Our death counts and hospitalization counts are trending downward as well. The key to this success is vaccination. So happy to see that we have 58.9% of our population, which is 451,735 people who have completed their vaccine series, and 68.8% who have had at least one dose, and that is 527,736 individuals. If you take a look at the line chart to the right, we see that our first doses have gone up a little bit in November, and that likely represents the inclusion of younger children. So kids who were not eligible until a couple weeks ago, now getting their first shots. And then the bright green booster line also representing an increase in booster doses for adults in the population as well. So we've had over 11,000 kids get vaccinated in the 5 to 11 age group so far, including mine, which I'm very happy about. So we have seen the vaccine rates increase in the kids, and also, as I said, we've had quite a bit of boosters coming online for adults. Hospitalization rates are relatively stable. ICU and ventilators, likewise, the numbers are stable, but they are not as low as they were back in the early parts of the summer. So perhaps we have weathered the Delta surge, but the low that we're reaching now is not quite as low as what we had before. And that is it for the data review. Thank you.
Thanks, Doc. Let's go into a couple observations and questions. It seems like we're on a plateau now around that 25, bumping in and out of the red. So that's, we're thankful we got a lot more people vaccinated, right? But we're still having an epidemic amongst the unvaccinated. And the frustrating thing, of course, is that people can do something about that by getting vaccinated. We're seeing outbreaks, kind of a fourth wave in some parts of Europe right now that can tell us what the virus would like to do with us here in all of America. I think there's a couple states up north that are experiencing a greater breakout as well. So we are far from out of the woods on this right now, as we know. We got some good news, right, in terms of the vaccine being available to younger folks. So kids 5 to 11 right now are eligible. You mentioned that. Congrats on your child there. But how, in general, does it seem like the community is responding to vaccine availability for our youngest citizens?
I think there's been some great excitement from parents who have, uh, maybe the rest of the household has already been vaccinated, and their first grader has been the last one out. So I know there's uh, been a lot of families who are excited to sort of complete the set and get the last of their household vaccinated, especially as we lead into the holiday season. I know I myself, as I said, my daughter got vaccinated, and it was very exciting for us to know that we've done everything that we can to help protect her. We've had 11,044 kids in that age group get vaccinated across the area so far. A big event with Jefferson County Public Schools a couple weeks ago. And, you're seeing our list of COVID vaccine sites here on the website. There are many that are offering vaccines, including boosters for adults, and quite a few now that have the separate dose for the kids 5 to 11. So many of our public health sites offer that service, and so do our private sector partners as well.
Okay, so some decent momentum, need to scale further. Is that the
Yes.
takeaway?
Yeah.
All right. Okay, let's talk about boosters. I got my booster probably a month or so ago now. News just the past couple of days on who's eligible for the booster. So please summarize that for us.
Absolutely. So we've had boosters available for a decent section of the adult population here for a few weeks. That guidance was a little bit complicated in how people were eligible and things like that, but the FDA has simplified that for us this week by saying that anyone over the age of 18 is eligible for a booster. So if your first shot was Janssen, you can get your booster after 2 months. And if your first shot was either Pfizer or Moderna, you can get your booster after 6 months. And there are no other qualifying factors. So everyone is eligible if you're over the age of 18 and it's been long enough since your previous shot. There are no boosters online for uh, kids under 18 at this point. It seems that their robust immune systems are holding their own after getting their primary vaccine series.
Okay, so that's great news regarding that. So we still have some folks that have staked out a position against the vaccine. That's unfortunate for the society as a whole, but particularly unfortunate for them. And if they're in a cohort of people that are being unvaccinated, because that's where we're seeing the virus still ricochet amongst largely this group of people that's unvaccinated. So we're in a lot better shape this Thanksgiving than we were last year. You'd have to ask, well, why is that? And the answer is obvious. It's because of vaccines. We have a lower case count than what we have right now. We got about 1,400 new weekly cases, and that's troubling and way more than what it should be. Last year, we were closer to 3,500. So it's quite a bit of progress since last year. And you can ask, well, why is that? Again, it's obvious, right? It's the vaccines that are making this happen. So most people in our community are vaccinated, as you reported, and trending that way. But there's still too many who are not, and we've got our holiday season upon us with Thanksgiving and Christmas and New Year's coming up. So what do we need to do to have a festive holiday season coming up here with folks that are nearest and dearest to us while still staying safe? What's your advice for that?
So, as you mentioned, the number one tool that we have in our toolbox right now is vaccination. So, if you haven't gotten yours, it's not too late. You can go out, and there are many places available to get one. If you are heading into a Thanksgiving dinner table where you know that you're surrounded by other folks who have been vaccinated, there's still not a 0% risk, but the risk is much lower, and you can feel fairly safe about participating in an event like that. If no one at the table is vaccinated, then your risk of someone bringing the virus to dinner is higher. So we would recommend that, first of all, if anyone has symptoms, if you have a fever, if you have cough, that you please stay home and not expose the rest of your family gathering. So first thing off the top, even if you are vaccinated, please stay home if you have symptoms. But otherwise, we would recommend that you participate in some testing before your Thanksgiving gathering. So there are lots of places to get tested. There are over-the-counter home tests that you can get. Lots of opportunities out there. And if you test a couple days before and the morning of, and you are negative in both cases, you would feel pretty good that you're not placing anyone else in your gathering at risk. So testing, especially if you're traveling, is a vital piece of the equation. And there's plenty of testing availability out there for those who need testing resources.
Good. We'll talk about that a little more in a minute. But before we do that, I want to ask you about flu and the flu season, flu shots. How we doing as a community?
So our flu numbers are relatively low this year. They sort of similar to last year. We saw folks wearing masks and participating in other public health mitigation measures that reduced the incidence of flu in the community. We do still have some flu, and there's plenty of flu vaccines out there as well. So you can get flu vaccines from your doctor, from your pharmacy. And then some of our public health sites also offer flu. So lots of opportunities to get flu shots. It's not too late. You should still get one if you haven't yet. And if you're getting a COVID vaccine, you can even get them on the same day, but get one in each arm. Keep yourself balanced from getting too sore, but you can even get them on the same day. We do continue to monitor flu, and certainly folks who are unlucky enough to get infected with both flu and COVID at the same time have the potential to be very ill. And so it's something we're keeping an eye on, but at the moment, doing okay on the flu front.
Good. And supply is fine for flu shots.
Yes, there's plenty of flu shots available out there. Those who are over 65 who need the high dose flu shot, that's a little bit more challenging to find, but there's still availability in the neighborhoods and in pharmacies and doctors' offices.
Uh-huh. Dr. Moyer, after you get a flu shot, do you have any kind of personal routine you do to make sure you don't get sore?
No, I think I just expect to have a little bit of arm soreness, maybe feel a little bit off. But the more flu shots you get, the less those symptoms are. So over the years, those side effects are less and less, which I think we're seeing also with the COVID vaccine as well too. So not a reason not to get the flu shot. Hoping everyone does this season.
Okay. So, I mean, you don't drop to the floor and do 25 push-ups or anything like that?
No, I know people that do, but yeah, keeping that arm moving. If you do feel sick, taking some Tylenol or ibuprofen after the shot is okay as well too.
Okay. Well, I appreciate your all seriousness about this issue, but we can exercise our way through it too. All right.
Yeah.
We talked about testing because it's an important part of holiday safety. Testing has never been easier. It's never been more available. Never been so many different types of testing as well. So I want to ask Connie Mendel. She's the Assistant Director of Louisville Metro Public Health and Wellness for an update on the Say Yes program, which we were thankful and grateful to be one of the few cities in America to be chosen for that. So Connie, what's the latest?
So we're really happy to report the Say Yes to COVID test program we feel has been very successful. We've been able to provide nearly 318,000 at-home test kits to the community. So 148,000 of these were ordered online and delivered directly to residents' homes in our focus areas. And over 170,000 tests have been shipped to 80 organizations throughout the community. So, and many of those organizations, our community partners, still have tests available to pick up. There are, and here's Chris is showing the locations now. So there's over 40 locations, I think we're 45, where anyone can go in and pick up 8 at-home test kits. Many of these are libraries, Metro Parks community centers, different clinics and social service organizations, along with faith-based organizations. So again, anyone can go in and pick up their kits, which would be 8 at-home tests, and this is the perfect time to use them, as Dr. Hartlich mentioned. With Thanksgiving on Thursday, today would be a perfect day to use that first one. And then again, Thanksgiving morning, before you leave the house, make sure that that at-home test kit is, or that at-home test is negative. I also want to mention, just in the last week, there's still, testing is still readily available in the community, whether that's the traditional PCR tests. Over 1,100 of those were, actually over 20,000 of those were conducted last week. 1,100 being positive from the ones reported to us. And if you look at PCR and antigen tests, which this at-home test kit is an antigen test, we've over 32,000 of those have been done in the community. So there's still a lot of testing going on, which is great. As the doctors have mentioned, that is the key. Only after vaccinations, of course, vaccinations are first, but then testing to make sure that we know our status and we're not sending that out in the community.
Yeah. And increasingly in the community, I've been going to events that require, proof of vaccine, proof of testing. You can see that in other cities as well. So I think you'll see more and more of that. So just another reason to get vaccinated or certainly tested as well. So thanks for all the good work with the Say Yes program. And as you can see in the chat here for our media, LouisvilleKY.gov, you can drill down there and get more information about the testing. All right, Kathy, I'll throw it back to you so we can go through our media questions and take it from there.
Okay, thank you, Mayor. This first question is from Tara Bassett. Tara says that she spoke to a group in their late teens and early 20s who were unvaccinated. She asked why, and they said they're waiting to see what the side effects are. Dr. Hartlich, I'll start with you and then follow with Dr. Moyer. Can you all address the proportion of known side effects to the risk of long haulers or death, or what might you say to those people in their late teens or early 20s?
Sure. Thanks, Tara. So for our young folks who often, this is something we hear often from them, right? That they are nervous about side effects, or that they feel like they're not at sufficient risk from the disease itself to need vaccination. So we would say that the current data suggests that 50 to 80% of people who are infected with COVID have symptoms that linger as long as 3 months, and 20 to 30% have symptoms beyond 6 months. You don't know whether that's going to be you. There's no way to really predict who is going to be impacted by those long-term symptoms. And while death or severe illness and hospitalization is rare in that age group, it could be you, and that is an irreversible situation. Hundreds of millions of doses of these vaccines have been given worldwide, and there is no significant long-term side effects that have been noted. We've been giving them for over a year at this point. There is substantial misinformation out there, but no good data to suggest that there's any reason to wait on vaccinating, and that everyone is at risk from the disease. So the best thing you can do is to get yourself vaccinated and protect yourself, and also protect those in your life who may be at higher risk by not bringing the virus home to them as well.
Dr. Moyer, you have anything you want to add?
I think that was a great answer. I mean, I think in short, we know that the side effects from the vaccine last a day or two, and then the side effects from COVID can last years, and we don't have any long-term research. But as she mentioned, I mean, mental health is a huge one. I think a third of the people post-COVID still have anxiety and depression, like the brain fog, fatigue. All those are things that I hope that our younger generation doesn't have to live with for years to come. And so if you've been lucky enough to not been exposed to the virus yet, definitely recommend vaccination. And if you have, still recommending vaccination after you finish your isolation period. There's been some studies that show that it does help with the side effects too. And so if you've had it and are still having side effects from COVID, that is a reason to get vaccinated. And so just hoping more people we get vaccinated, the safer our community is.
Okay, thank you. This next question is from April Rickert. April is the new health reporter with WFPL. Welcome, April. How has the city done outreach to help get boosters for the unsheltered houseless population? And Tara also had a follow-up with that. Since our houseless population got the J&J, what's the timeline for boosting them? Dr. Hartledge, can you answer their questions?
Yeah, so we definitely recognize that our houseless population can be at particular risk from COVID. They may be in close quarters, in a congregate setting like a shelter, or they also have lower access to healthcare across the board and may be at risk for COVID from that aspect. So in the early days of the Janssen or Johnson & Johnson vaccine, we made efforts through shelters and also through encampments to vaccinate those folks. And we have continued to offer COVID vaccines in a collaborative in events. So we have gone to encampments, for example, and provided hygiene services like a shower trailer, food support, HIV testing, and COVID vaccines all in one package. So our houseless population is certainly eligible for boosting, just like everybody else, and some have received their boosters already. The family health centers they operate the Phoenix Healthcare Center for the homeless population, and they also specifically serve that population and deliver COVID vaccines through that site. So sort of a multi-pronged effort through the Phoenix site, also some efforts at shelters, and then events specific to encampments with testing and vaccines across the board.
Okay, thank you. This next question is from Paul Miles with WHAS Radio. Dr. Hartledge or Dr. Moyer, what are your travel recommendations for Thanksgiving? I know, Dr. Hartledge, you covered some earlier, but Paul is saying, should people traveling out of state quarantine when they return? Dr. Hartledge, what would you say to that?
So I think that if you are vaccinated, and especially if you have been able to test and prove that you are negative, that you don't need to quarantine. If you're unvaccinated, you should consider quarantining, and you should definitely consider testing if you're unvaccinated. Really, testing is appropriate for everyone. So testing before you leave, testing when you return helps to keep you from accidentally bringing that virus back into a school or work situation when you return. So we recognize that people want to spend time with their loved ones, and not all of us have loved ones right down the street. Some of us have to travel for that. So we definitely appreciate the situation that puts people in. But testing and vaccination can help you do that in a safe way.
Okay, thank you, Dr. Hartledge. And that's all of our media questions. But before I turn it back over to you, Mayor, I think Dr. Moyer had one more point she wanted to make.
Thanks, Kathy. Yeah, I just want to recognize that yesterday was Public Health Thank You Day. So just wanted to give a huge shout out and gratitude to my team. Louisville has one of the most dedicated group of professionals keeping our community safe and working to create an environment where everyone can thrive. So just thank you, public health workers, and then thank you to all of you as well, too, who have become public health experts over these past 2 years. Could not have kept the community safe without you. So I'm grateful this Thanksgiving for all y'all, and so just wanted to say thank you. And for COVID, yeah, don't forget to test before you hang out with your family, and then test again before you go back to your workplace, even if you are vaccinated. Because we are seeing about 25% of our deaths are vaccinated, and about 18% of our cases. And so it's a huge help. It's a huge difference to get vaccinated, but it's not 100%. So testing, spacing, keeping those masks on, having good ventilation, keep up all those extra things we know that work. And happy Thanksgiving to everyone.
Thank you. Mayor Fisher, we had one more media question come in, and this one is from Jose Damas. Why is it that some places won't let you decide and choose what booster you want? Dr. Hartledge, Dr. Moyer, do you have any information on that or any insights you can offer? Dr. Hartledge?
So, Jose, you are correct that you can mix and match products now. So if you got Pfizer or Moderna the first time, you can choose the opposite product for your booster. It does not, there's not great evidence to suggest that you need to do that necessarily, but you can if you feel like that's what you want to do. Many places only offer one vaccine product at a time. They may only stock one product, or they may only offer one on certain days, things like that. And that's generally related to operations and the ability to maintain an inventory and safely administer vaccines. So they are likely related to operational issues and not necessarily to clinical decision making as far as mixing and matching your vaccine products. I would suggest that if you go to vaccines.gov or text your zip code to Get Vax, it will list the sites by product. So if you are particularly looking for a Pfizer or a Moderna or what have you, that you can search by product and make sure that you are visiting a site that does include the product that you're looking for.
Hey, thank you, Doc. Appreciate that. And just let's close by wishing everybody a happy Thanksgiving. If you still are not vaccinated and have questions, please get those answered. That'll be a way that the whole community can be thankful for that. I want to thank our public health team too. They have been relentless under very adverse conditions to attack the virus and keep our community safe. When we reflect back now on the 18 months, 20 months that we've been living with the virus, and think about the startup of Luvax and the close down of Luvax and Luvax Mobile and all of this activity, it's incredible what people can do when they're dedicated to helping others. So I want to thank our public health team for that. I want to thank the fabulous Delano Manson, who I've seen on here. I don't know if you're hiding there, Delano, if you can hear us or not, but the Kentucky Nurses Association has been an incredible partner with vaccinating the community as well. So a lot of folks have really answered the call to help. So just want to say thank you to everybody. Very grateful for you all here every day, but especially here as we approach this time of thanks and holidays for our community. So with that, everybody, be safe. Come out and join us at Light Up Louisville on Friday. Be outdoors, so it should be safe. Wear a mask for double protection if you like. I did have a very secret phone call through an encrypted channel last night with the North Pole. I could not talk to Santa Claus directly, but Mrs. Claus was still working, and she did confirm that St. Nick, the man from the North Pole, is scheduled to be here at 8 o'clock on Friday. So keep that in mind as you have your holiday plans, and bring your kids out and enjoy a lot of Louisville and say hello to Santa Claus. Delnor, I see you on there. You popped on there when I talked about Santa Claus. I understand you've been a very good girl this year, so you will have plenty of bounty to celebrate. So thank you to the Kentucky Nurses Association, Delnor.
Thank you, Mr. Mayor.
All right. So with that, everybody, we say God bless. Stay safe.